Some people have a corneal condition that causes their ophthalmologist or corneal specialist or optometrist to suggest that they get fit for something called a scleral contact lens. If you Google scleral contact lenses online, sometimes you can find these very intimidating big lenses that look a little scary to be putting into your eyes. And so oftentimes by the time patients come in to see me, they are a little freaked out by what exactly it means to wear a scleral contact lens. So that's why I want to walk you through exactly what it means to be wearing a scleral contact lens and how to know that your provider is well trained in this area. First, a scleral contact lens is actually just a large contact lens. I'll show you an example. So this is a 17 millimeter contact lens, okay? So if you can see in the camera, it's kind of big, but it's not ginormous. So you can put this lens in your eye after you fill it up with solution, and then you put it in at a 90-degree angle, and this can correct a lot of the astigmatism in the eyes. So they're very, very effective for people who have keratoconus, irregular astigmatism from other types of corneal ectasias, like an old LASIK procedure. People who've had RK many years ago benefit tremendously from a scleral contact lens, and even people who have perfectly healthy corneas, but the surrounding tissues are creating a dry environment for them. So for example, people who have Sjogren's disease, thyroid eye disease, difficulty with closing their eyes either from a Bell's palsy or a stroke, or the list goes on. If the lids or the front surface of the eye are not 100% healthy, scleral lenses are helpful in terms of creating a healthy environment and then also giving very impactful vision. So that's in a nutshell what a scleral lens is supposed to do. Now, there are lots of different sizes of scleral contact lenses. So I'll show you compared to what I just showed you before, the 17 millimeter. There's also what's called a mini scleral. So these ones are just over 14 millimeters. Okay, so that's kind of the size that a normal contact lens is, but it works the same way. You fill it up with solution and you put it in your eye like that. Now recognize that solution stays inside all day long. So these are actually very, very comfortable. So I'll give you an example of someone that I saw this week. This was a man who wore RGPs, or I should say he tried to wear RGPs. Like 30 years ago. RGPs are rigid gas permeable lenses. They're small diameter. If you used to wear contact lenses like 30, 40 years ago, this is the only type of contact lens that was actually fit for anybody, not for anybody special with astigmatism, but everybody wore those lenses. Now, most people moved into soft contact lenses if they don't need contacts for a medical reason. But people who have a deformity like keratoconus still benefit from having that hard contact lens. So this is a guy that was fit with RGPs. The problem with them is that they are very, very uncomfortable to get used to in the beginning. Sometimes they're still necessary. They could be really helpful for people if they're not a candidate for scleral contact lenses, but there's a time period that it just takes a while to get used to them. Sclerals are not like that. Sclerals are comfortable from day one. As long as they're fitting right, they should be very comfortable. So he was really concerned about putting something in his eye because he remembered having this bad experience of RGPs many years ago, and he's just been struggling to see in his glasses. So he came in, we tried a scleral on him, and he was like, wow, I don't feel that at all, and his vision improved down to the 20/20. So those are wonderful candidates for scleral contact lenses, are people that it was recognized that they would benefit from having a hard contact lens and found the RGPs just uncomfortable. Another patient that I saw this week is someone that has been noticing that his vision is getting worse and worse and worse over the last few years. Also someone with keratoconus. He does not want to have a corneal graft, which is the next step for him. And so his specialist referred him for a scleral lens fitting. Now he, again, had tried lenses elsewhere in the past. Didn't work for him for one reason or another. We tried a scleral lens, literally almost cried from happiness because the lens was so comfortable, and he was immediately able to get down to the 20/25 line when he came in seeing 2100. So that was a huge deal for him. So we have that on order. let's see. Another interesting one was someone who, this was interesting. So this was a guy who tried to wear scleral lenses. He was fit by someone who is specialized in scleral lenses. And even though his vision improved with the lens, he didn't understand how to get the lens in and out properly. I think he went through like 4 sessions of insertion and removal training and absolutely could not do it. And so they said, this is not going to work for you. It's time to move on. So he decided to come in for a second opinion. And I will tell you, he walked out with his lens, he just needs it in one eye yesterday. He was able to get it in and out 3 times, no problem. Sometimes it's just about being a little bit patient with finding the right technique that works for you, but I've never actually had anybody fail who's motivated to do it. So he is now able to see 20/20, and he is wearing his scleral lens very comfortably. We're going to see him back next week. So if you are someone that is interested in trying out a scleral contact lens to see if it's for you, don't just get intimidated by what you read about online. If you come in for a consultation, I can walk you through the process. I can pop a lens on the eye, and the consultations are completely free. So it gives you a chance to try out these different lenses, feel them, touch them, see what it's like in your eye to see if it improves your vision and if it's indeed comfortable for you. If it is, then you move forward. If it isn't, then at least you crossed it off your list. And with that, thank you so much for watching. If you have any additional questions, I'd be happy to answer them. Just reach out to Michigan Contact Lens and we can try and answer some of your questions.